Gentleman yields. The chair recognizes the ranking member of the entire committee, Mr. Pallone, for his 5 minutes of questioning.
Unlike our hearing last September, we have the benefit of HRSA in attendance as a witness, and we have solid evidence-based examinations conducted by HRSA. That's also directed the OPTN to make a monitoring plan for the Kentucky organization that is the focus of its investigation, and a system-wide policy on protocols to pause the organ procurement process when there are concerns about the patient's status. And these actions, I think, will better protect patients across the country during the pre-donor phase and increase confidence for would-be donors that their safety and interests will be addressed in the process. But Dr. Lynch, does the corrective action plan, which is now public, send a message to all OPOs and relevant OPTN members involved in patient care that OPTN oversight is becoming stronger? And what do you hope the impact of that shift will be on the culture at OPOs and the OPTN? I have 4 questions, though, so please be brief. Oh, your mic is not on. Mine wasn't either.
Sorry.
Go ahead.
I'd like to emphasize the vast majority of providers are doing this in good faith, and every day they show up trying to do a good job. This shows that HRSA is doing the same and that we are committed to maintaining a safe environment. And so if they see something that is wrong, that they can plan for a future where we are doing that better.
All right, and then what was it that you saw in your investigation that made you believe more safeguards were needed, specifically for potential donations after circulatory death?
The primary problem in Kentucky related to them failing to reevaluate their initial neurologic exam and failing to see that instead of somebody slowly getting worse or staying at a very low level of brain function, that they were in many cases recovering.
I see. Now, HRSA's report concludes that the Kentucky OPO disregarded or dismissed any indication that a patient who was identified as a potential donor would ultimately not be eligible for donation. And from the report, the OPA appears to have been determined to proceed with the donation protocol until it was forced to stop by a physician's refusal to do the procurement operation. And various hospital staff do not appear to have stepped in to stop the process either until the very end. And despite this, some organizations argue that discussing concerning cases like this openly leads to fewer donations and harm to the donation and transplant system. So, Dr. Lynch, I can't believe I'm asking you this because it seems absurd, but what is HRSA's response to criticism that identifying and discussing lapses in patient safety in the OPTN is harmful to the system? I mean, I don't agree with that, but go ahead.
So I'll keep it brief for your other questions. It's twofold. The first is that trust is earned. It's not to be expected. It's earned every day. And the second is that no system ever improved in the dark. We need to have good data. We need to show that we are paying attention.
And look, the bottom line is transparency is everything. You know, I mean, I've been here a long time, and if you don't have transparency, ultimately, you know, things don't work. So I totally agree with you. Last question, though, you can take time on this. What are specific ways that improved oversight of the system will help restore confidence that the OPTN is safe and effective and that people should be organ donors? You have almost 2 minutes to answer that one.
So again, the adequate collection of data, the OPOs already collect these data on the patients with whom they interact, making sure that that's relayed to the government and that in turn is able to be used for analysis and for public use. The OPTN already is a leading example of making all data that we have available to researchers and policy advocates, adding in all the data on either end, the individuals with whom OPOs interact before they are organ donors, and the individuals with whom transplant centers interact before they are on the wait list will help us to really understand the system and make sure that we're providing consistent, good care.
All right, thank you. I mean, if the goal is trust in the system, there has to be consistent standards for all OPOs to avoid disparate treatment for patients based on where they live and receive care. And HRSA's corrective action plan, I think, is a step in that direction. And the OPTN and OPOs should welcome a constructive response from HRSA to prevent egregious incidents that put patients at risk. It's very important. So with that, Mr. Chairman, thank you. I yield back.
The gentleman yields. The chair now recognizes the vice chairman of the committee, Mr. Balderson, for his 5 minutes of questioning.